Dr. Gemmill, you are going to speak about open fractures here at Scivac Congress 2017. Can you tell us something more about your topic?
So I think open fractures are still a huge challenge to vets facing these patients. One of the big difficulties is we have to deal not just with the healing of the fracture, but also the healing of the wound and the way these two interact with each other, and that presents us with quite a lot of challenges. Obviously with open fractures they are contaminated by their nature, so the risk of complications, of infections developing afterwards is going to be higher than for a standard fracture. And also often the tissues we're dealing with are very compromised. We can have crush injuries to the tissue, so there's very frequently a compromise to the blood supply to the bones, so the risk of delayed healing, of non-unions, of a series of complications resulting from these fractures is much higher, and that's something we have to think about very carefully when we're planning how to manage the patients.
And what has changed recently in the practical management of this kind of fracture?
So I think a really big thing for me is the importance of stability, not just for the healing of the bone, but also for the healing of the soft tissues as well. We for years have recognized that managing the biology of a fracture, the mechanics of a fracture are very important, but really for wound healing people are very much just focused on the biology, the blood supply, avoiding tension, but I think creating stability in that wound environment helps hugely with the healing of the wound as well as with that healing of the fracture. Now, one big thing for me is that historically people have been very afraid to put implants into these fractures. They're worried about the contamination, the risk of infections that we could see, and people have not wanted to put internal fixation in plates, screws, pins and nails and so on. So traditionally people would tend to manage these fractures with external fixation. Now, one of the problems there is external fixators by their nature have a higher morbidity. There's a lot more management of the patient afterwards, and another problem we see is fixators have a finite duration, a finite life. They come loose in the bone, the pins will loosen, and often the stability at the fracture site will diminish as that frame loosens. What we commonly see with an open fracture where healing may be delayed is the frame loosens before the fracture can heal, so we end up having to do revision surgeries. So I think for me a big change recently is really concentrating on getting the stability at the fracture site with internal fixation, and if we make things stable we get much better results, much lower morbidity that way. Avoid the fixators, really go for the internal fixation.
That was very clear. Thank you very much.
Thank you very much.